Welcome to Live at 5. I am so excited to finally be on a live event here with you. It's been a long time, so I'm just delighted to connect and to bring on a very, very special guest. She was the first guest I ever had a live event with, and she's coming on again, and that's Katherine Golden from Leaf 411. So I want to give a little introduction for Katherine as people are coming on board. Hello, hello. Hi. I'm so glad to see people coming on and oh gosh, to see names that I see in the comments like every day. So I'm just so happy to connect live. Like, yes, I still exist. So again, I'm so delighted to have Katherine coming on with us. She is a registered nurse with 27 years of experience. She's a cannabis nurse educator, and she's CEO of Leaf411.org, which is a nonprofit organization dedicated to the education and the proper use and the effective use of hemp-based products. She's actually obtained multiple cannabis nursing certificates, and she serves as the clinical director in Maryland and a nurse consultant in Colorado. She's a very active member of various cannabis-related groups, and she stays up to date on the latest science and issues. And she has helped me so much in my journey with my dear husband, Ben, as you all know, who's living with Lewy body dementia and has been helped tremendously by the use of cannabis-based products, hemp-based products. So let's bring Katherine on board here, and it'll take just a minute. Will this be long-winded or to the point? I hope it's not long-winded. And so we've got some questions already coming in. Hello, Katherine. Can you hear me?
I can hear you.
Yes,
Can you hear
yeah,
me?
good.
We did it.
I have to laugh because somebody just asked if it was going to be long-winded or if we get to the point. Let's get to the point, because actually we have a
Yes.
lot of good information to share, and part of which is going to be my own journey with Ben. So it's a real live case study that you can certainly share in terms of how you guided me. And then also, as I said, we'll leave some time for Q&A at the end. So
Yes.
Katherine, though, before we get started, can you just fill in the group who may not be familiar with the organization? What
Mhm.
brought you to the point where you were founding an organization of a nonprofit organization of cannabis trained nurses? So what prompted you to do that in the first place?
Oh, well, thank you, Diane. And I thank the community for allowing me to be here with you today. And we'll get right to the point. The story with me is I saw the need of just caregivers, patients, loved ones needing help on this cannabis journey. Where do I start? Who do I need to talk to? What products are quality products out there? Just every question you can think of. So I wanted to make sure that it was either free or reduced cost because it's all out of pocket right now. And so I started this cannabis, national support line. Ooh, 5 years ago
Wow.
already. We're going on our 6th year, and yeah, it's exciting. And we're registered nurses and a team of actual licensed professionals that take calls. We've taken them all across the country and even outside the country, answering questions and giving resources. So that's what we do is we provide those resources to you. If you're looking for, any questions you have, we will point you in the right direction, or we will find that answer for you and send it
Well,
to
and
you.
that's certainly what you've done for me. And, my husband, as you well know, Ben, has been living with Lewy body dementia for, well, probably longer than 4 years, but our obvious journey has been about 4 years now. And early on, I wanted to bring, Ben on board with products. And quite honestly, I was flying by the seat of my pants, as you said. I didn't know what to
Mm.
do. I knew that he had used products in the past for his own anxiety, but now all of a sudden he's on other pharmaceuticals. He's got a condition that I barely know how to deal with on a day-to-day basis. And yet he had, so much anxiety, agitation, he wasn't sleeping. And so I confess, I live in Pennsylvania where I could get some products. I got his medical marijuana card, but he refused to take anything. I go across the bridge into Jersey where they have recreational use and I buy gummies. I mean, that's where I started. And thankfully, I came across your organization when I was searching to get things online, and you guided me from the start about some products to stay away from and to be, mindful of in terms of their quality. So, can you, first of all, maybe speak to some of the sources of products and how that can vary, and why, and how your organization can guide us accordingly as caregivers?
Yeah, it's been a long journey, and I think that that's why Diane and I are so excited to come on tonight to tell the community, now that we're getting lots of calls from caregivers at home wanting to know, well, what's Ben doing? Where did he start? What's his journey been? And I want that exact plan for my loved one. We've been working together for a long time. I want to say like a
Yeah,
year and a half or
yeah, that's been
longer. Yeah, and it's been a journey. And like Diane said, she came to us and she found us, which was wonderful. And she said, "Okay, here are the products that I've been having been consume, and what do we need to do differently?" And when we took a look at the products, and we look at the difference between a synthetic product and the difference between a full spectrum, hemp derived or a cannabis derived product, and we looked at the regimen that a patient is on or a loved one is on, and we see, okay, is this the best for his behaviors? There are these dementia behaviors, and gosh, my heart goes out to all of the caregivers because they're dealing with a large array of different type of behaviors that come along. And it's just, we went through what he's using, what the evidence shows as could either help or maybe be more beneficial for those behaviors, and we just took it one by one. And I think that's the beauty of cannabis, is that you usually take a compound or two, you see which ones work best for certain behaviors, and then you incorporate those. And it's a trial, but the beautiful thing is you had nurse support to say, okay, let's try something different, or let's turn down some of these that we're using and turn up some of these. Maybe it's the frequency, it's everything combined. It's the combination of the parts of the plant to the dose that matters to the frequency that matters. So all of those, we talk to you and how we could make it a little bit different for Ben.
exactly. And for those of you, as I said, that feel comfortable perhaps using some of these products, I was in some ways. I didn't realize, I think, how much help I needed, to tell you the truth, because Ben's a musician. He actually did use THC. Quite honestly, he used cannabis products kind of on a fairly regular basis. So I wasn't really afraid to try it. But my tendency was to increase the dose of THC
Hmm.
to help his agitation. And cannabis, and parts of the plant can have that biphasic effect where up to a certain point it can decrease anxiety, and then beyond the point it can increase it. And that's, I think, part of what I was experiencing with Ben, because early on I was giving him the gummies, and based on some, I won't see bad information I got, but perhaps uninformed information I
Hmm.
got. It was suggested that we give him the gummies like every 2 hours, and so I was like, okay, and I felt like we were in a way dosing him and not doing it with the kind of precision that we're doing it now. And I actually have at this point switched from using gummies to using extracts, because for us, we can get the dose a lot more precise. And
Hmm.
Ben is fine with taking, extracts, and we combine them, so it makes it easier. But now we've got a much different interval. For that was the other thing that we talked about was, as you mentioned, what's the form that we're using, what parts of the plant are we using, and what's the interval. So it's been very helpful to have your guidance as we were figuring that out.
Yeah. I think a lot too is what's important is timing, like we talked about. Having it with food is important. I've talked to a lot of caregivers that are really focused on the sundowning that comes along the late afternoon and making sure we get the dose timed a couple hours prior, so that it could help their loved one, get through that a lot easier, less anxiety, less agitation. So all of it is, it can be complex, but if you have guidance, that's what we're here for, is take some of that heaviness off your shoulder and let someone guide you who's trained in it, so we can say, okay, these are the more ideal times to consume it. These are the different routes to consume. Like you said, even oils, gummies, beautiful forms of cannabis that you can take, but there's some tweaking that needs to be done. So this is where we can hold your hand, and that's what nurses love to do, is hold your hands and walk you through this. So I'm glad we've been able to do that for Ben. Our team of nurses have talked to you and said, okay, this is what we do next. And then get it follow up, because that's what really helps us, and really helps a lot in the industry learn how these products are affecting your loved ones. Do they help the behaviors that we want to see
And let's
change?
talk about some of those behaviors, because I know
Hmm.
that we have caregivers in our community, some that are taking care of individuals, that have the dementia related behaviors, but others as well. So I know, let's talk first about some of those dementia related behaviors that can be helped, and then some others as well, because I just saw some comments come through about
Hmm.
appetite stimulation and
Hmm.
everything. So I know, as I said, for myself, in terms of Ben, we've been able to help his agitation, his anxiety, and that's a little bit different, for us. And I think some people have seen him actually sitting calmly eating a meal
Hmm.
where he couldn't before, because he just kind of had to keep moving. So that agitation and anxiety has been helped. His sleep patterns have actually improved as well, and he's getting longer periods of sleep without waking up, which is miraculous.
Yeah.
Um, and
Hmm.
then he is not aggressive per se, but I know that can be such an issue. So can you talk about some of the other dementia related symptoms that can be helped with cannabis products?
Sure. A lot that we hear is that aggressive, almost abusive behavior. It's hard because their loved one doesn't mean to do these behaviors, but they come out, and I have ones that say, oh, well, he, takes a swing at me every day, even though it's soft and he doesn't mean it. It's just a behavior that happens. So how can we calm that behavior? How can we steady the mood? Also, we have some that, there's that repetitive behavior too, that they're constantly fidgeting with a towel, or they're tapping on something, or constantly shaking their leg. What can we do, because their body seems in such an excitatory state, and I want to help my loved one be calmer. And that's the beauty of what the evidence shows that cannabis can provide, depending on which parts of the plant and how much of that plant you use, how much together. So all of these different behaviors, and like you said, we saw someone just ask about appetite stimulant. Yes, that actually THC is really great for that. So there's all these different changes that come with dementia as it progresses, and we just start looking at each one of them as they get a little different. How can we integrate different parts of the plant that shows evidence in being possibility to either calm that behavior, or just provide more of a balance to the body, and that's what we're looking for.
Exactly. And I'm going to do this, I think, throughout this program as people are joining, to get in touch with these amazing nurses from Leaf 411. You can go to the link in my website. It'll
Mhm.
actually take you, there's a button that says dementia relief. But even if you're looking for other kinds of relief, it will take you to the Healer CBD site, which is, we're going to talk just a little bit about the source of products.
Mhm.
And I do use products from Healer CBD, but you can get in through that link. And if you scroll down just a little bit, you'll see where it says book a consultation. You can get in there, you can book the consultation. And I believe that the Healer site, I know that you asked, you're very reasonable in terms of asking for a $25 donation, certainly for your time. But I believe that Healer actually does pick up
Mhm.
that fee, that donation, even if you don't buy products from them. So
Correct.
they are, and will,
Yes.
an amazing company in terms of how much they care about spreading the word and increasing awareness about the use of these products for dementia related symptoms and other conditions, certainly. So that is one way to get to the site, and to book a consultation with Leaf 411. So we're so grateful to them to do that. So we're talking. So we talked a little bit about aggression, sleeplessness, appetite stimulation, decrease mood stabilization, which I think is again
Hmm.
we could all use to tell you. But and I think as far as the way I worked with you, I came and said, let's talk about the symptoms that are most distressing, not just to me, but to Ben. So we started with the most distressing symptoms and then we went from there. So I think what one of the recommendations you had made to me was let's take one at a time and then see
Hmm.
if we can get that under control and then we can go for the next one. And I think it was so important too that to talk a little bit about what to expect in terms of timing. So what, and I know everybody's different, but let's say
Hmm.
someone gets started on a product and they don't see the results they want right away. What are your recommendations to them? How long should we give a product, especially if they perhaps have never used hemp-based products?
Right. And that's a good question. That's a question a lot of people ask. What's really wonderful about the plant is that it's not like a typical pharmaceutical where you have to wait 30, 60, 90 days to have it rear its head and see what it's going to do for your body. Cannabis typically in an average person around 3 days you can start assessing it and seeing what's going to happen and how this person tolerates it. When you have an advanced age, then sometimes we give it a little bit longer time, like a week or so. So anytime anyone talks to us, our nurses say, gosh, we really encourage you to do a follow-up 1 week later. I want to know exactly how your loved one is
Right.
tolerating this. And know all sides of it. If it's working, great. I want to know that too. If it's not working, definitely want to know that so we can adjust immediately. And that's the beauty of it. We can make some adjustments, and sometimes it's just like you were saying, Diane, sometimes it's just timing. Sometimes it's like, well, oh, I didn't know that they needed to eat, healthy fats with cannabis. It's fat soluble compound, so you need to have some healthy fats in it. And sometimes that loved one is, really apprehensive about taking anything you give, and that's why they've developed some of these products to be like the healer gummies, because now I have one that said, oh my gosh, my husband now, he loves it. He thinks it's like a little candy at night. So he actually takes this, doesn't want to take his other pharmaceuticals because they're
Right.
like medicine, but this is
Yeah.
enjoyable to take. And that's always heartwarming to hear, because we want it to be something that your loved one wants to take and you don't have to feel like you force it. But like you said, there's other types of formulations that comes in, like the oils. I have people putting it in a little bit of a tea or a smoothie or something. You can dissolve the little gummy in some hot water, and there's just all kinds of ways that you can make it to where it's not a struggle. We don't want that caregiver having to struggle with their loved one. So any way that we can guide you on how to have them, take it easily is what we can do. So, we work with everybody, and like going back to what you said, Diane, Healer is a fantastic company because they do support this public education. They want to make sure that anyone, regardless if you're purchasing their products or not, has access to a licensed medical professional that can guide them. So that's the beauty of this. And then we guide to however is best suited for that individual, because cannabis is so individualized. How it works on you or Ben is different how it's going to work on someone else's loved one. So we take the time to figure that out, ask a lot of questions, take one subject at a time. Like you said, what's the behavior you're most challenging? Let's focus on that and what we can do. And the beautiful part is, the program that, and I know you're going to talk about this, the program that healers develop makes it easier. So we don't have, like we did a year and a half ago, where we started with large amounts and now coming down to the smaller amounts that actually work a little bit
Yes,
differently and better for
it's
some.
it's quite amazing, as I said. In fact, forgive me, I meant to have the packages. Let me grab them right here to show everybody.
Hmm.
Um, what they have found, yes, is that sometimes the lower doses of THC can actually work better for people. And one of the things that I was so impressed with what Healer did was actually package the products so that they're right here. And it's going to be backwards in the camera here. But these are the respite gummy products. And they have everything mapped out for you in terms of, and these aren't actually filled with the products, but they actually come in individual sections here, so you can easily track where you are, how much you've given, and then they have, so the stage 1 is for daytime, and then this is for evening. So everything is spelled out for the caregiver. You don't have to be guessing. You can track exactly where you are. They also send a usage guide, which has been very helpful in terms of the kinds of symptoms to be looking for and what to expect, really. So it's just packaged in such a beautiful way together, along with your guidance. It's, I think, just made it, as you said, so much easier to track and to find just how it's helping your loved one. And so and as I said, the interesting thing is, for me at least, is now some of these different parts of the plant that are coming forward that can help some of the different symptoms. So can you speak a little bit to that? Like, for instance, when I first started with Ben, we were using THC and CBN, which had been touted as a product that was very good for calming the body. And I'm not saying there's anything wrong with it, but I now understand that that's like a weaker version of THC and might have actually been competing for the receptor sites, so that Ben wasn't even getting the full advantage of the THC. And this is why, again, I don't want to discourage people necessarily, but just encourage them to get the help from trained professionals, because going to the many sites where you can buy gummies, the advertising can really be misleading, especially for those of us that are dealing with some pretty serious conditions with our loved ones. So can you speak to, again, what they found about some other parts of the plant that have really been helpful, especially for dementia-related symptoms?
Yeah, and I'm just amazed. Look how much you know, Diane. It's from when we started a year and a half ago. You're talking about receptors and the different parts of the plant that we call cannabinoids. I mean, it's amazing. And it just warms my heart to see our education just coming out, because that's what we do. We want to give you that education so you can make informed decisions about your care and your loved one's care. And that, we started with looking at the different parts of the plant that you're using, because sometimes you'll go into a dispensary or you'll look online, like you said, and you'll say, okay, this CBN says it's can help me sleep, but so does THC, so I'll put them together. And then realizing, like you did through the education that we provide, that it's just degraded THC, and so it's weaker, but using them both was not as ideal as getting another part of the plant that actually shows evidence that can, boost mood, and help with sleeplessness also. So when you couple those together, it works beautifully. And that's where, we're just so thankful that we have manufacturers that have taken, the time and energy to put products out that are easier for people to use at home, and that's that full autonomy you have using cannabis. You can go to a store, you can go online, you can buy anything that you want and start using it. But, we really saw that this company not only has the world-renowned Dr. Dustin Sulak formulating it, seeing what was working in his practice that he still has today in Maine, still seeing patients, thousands of patients realize that, wait a minute, most dementia behaviors, we get better control with CBD and THC during the day, and CBG, cannabigerol, and THC at night. So, and a lot of people hadn't even heard of cannabigerol, CBG, but now you're starting to hear about it more and saying, okay, these combinations are what he saw was really working in his practice with dementia, these behaviors, and saw that, okay, and these doses, really low doses. And the morning is 8 milligrams of CBD with 2 milligrams of THC. Most people using 2 milligrams won't even feel it, but yet you get the medicinal effect of it, but you don't get the high that
The
people are
psychoactive
scared of or
effect, sure,
worried about.
exactly. And so,
Right.
and again, just to remind people, I did a live with Dr. Sulak, and I can actually repost that live, or maybe we'll schedule another one with coming
Yeah.
up, but just to reinforce what Catherine said, he was the only doctor, I believe, in Maine that would, I think, sign for people's medical marijuana cards years ago. So he ended up getting a lot of patients with resistant conditions and conditions like dementia. And that's where he started to do his own clinical trials. So these, again, unlike so many sources of these products, the Healer CBD products were formulated based on Dr. Dustin's Sulex experience with the patients in having dementia and other resistant conditions. So that's why, again, it does set them apart from my experience. And I just am so grateful to have found, again, these the advice from the professionals, as well as then the products that can answer the challenge. Now, the other thing, though, is if, and I'm sure that this is something that you can help individuals with too. I know that there are differences, of course, between states in terms of what can be shipped, you know, to states. Certainly, I know in other countries, I've spoken to some people in the UK where I don't think they can get, you know, some of these products. But can you just speak to that a little bit about the availability and how and what's possible? I know from my experience, there were certain things I couldn't actually get sent to me here in Pennsylvania. But can you speak to availability?
Sure. Sure, sure. So, and we get this question a lot because we get calls from all across the country and even out of the country. And, you know, once you learn or once we can educate you on the parts of the plant, it's almost like giving you the ingredients to the recipes. Then we can figure out where you're located and how you can access that. So for manufacturers that are really quality, they will have what states that are restricted that they can't ship certain products to. And it's only certain products. So say, for example, the healer products, the respite, there's a handful of states, a very small handful of states that they can't ship because it's hemp-derived THC and there's some certain restrictions. But, you know, there's a workaround because you have the other parts of the plant that the state says, sure, you can ship those. And then the THC part, you can go to your local dispensaries. You know, if you're an adult use state, then that's just 21 and over. Or if you're in a medical state only, then it's going to get a medical card and just like you did for Ben and go that route. But you can still blend the parts of the plant that are ideal for what you want to treat. So that's what's really helpful. And in other countries too, we can talk about, like, we look online as we're talking to people, where they're located at, where they have access, giving them the resources to what they can get their hands on, and then giving them the education they need to make that informed decision. Okay, what do I have access to? You know, and we like to talk about where there's most evidence. You know, that's CBD, that's THC. You know, in some of these minor, what we call cannabinoids, like the CBG, the cannabigerol, and CBDA, and looking at all of these versus the synthetic ones that there's not really any research on, and we don't know really how those are manufactured. There's no testing, things like that. So we give that education to everyone to say, okay, this is what you need to look for when you're looking for a quality
And that's so
product.
helpful too, because again, there's so many choices out there, and it can be scary. And I know the other thing too is I know that some people may have uh, the sense that they're dosing their loved one, and I just want to please, you know, reinforce that this has been so helpful for us. I mean, there have been times when I have, oh my gosh, I'm experimenting on a human body, but it's based on good, solid research, and that's why I did feel comfortable going ahead. And actually, it did get better results than we got before. Now, you know, as you said, in Pennsylvania, I needed to get the THC for Ben as an extract at our local dispensary. So I do have his medical marijuana card. I have my caregiver card. It's easy enough to get that online. It's not really a difficult process. It just may take a little time before those cards come in. But once you get them in your hand, it's easy to go to the dispensary and you'll guide us, as you did me, for what to ask for at the dispensary. And then in my
Hmm.
case, yes, I get the CBG from Healer, and it comes, you know, quickly, and I just mix the two extracts together, and it tastes good. I mean, and in that sense, I haven't been, and correct me if I'm wrong, Catherine, but the extracts that come in an oil. I should say it's a tincture. There's a difference between extracts and tincture. I use a tincture in oil,
Hmm.
and it's not quite as necessary to be eating, having a fat soluble um, meal associated with that, because sometimes I give it to him in the middle of the night, and then he's not necessarily going to be eating anything with that, but it does still seem to, have a positive effect. So, um, but again, can you speak to that? Is there anything else that caregivers should know if they can't get that meal into them, or the peanut butter or the
Right.
avocado?
Yeah, I mean, as long as during the day their daily diet includes some of those foods, that's great. We just want to make sure that that cannabis really sticks in the body. So, but there are absolutely lots of people that have to give that in the middle of the night dose, and that's great. You'll still see the effectiveness of it, because that loved one has had a good diet. So that's one of the first questions we ask when we do our intake. What kind of diet is your loved one on? There are a lot of people that, still think, that maybe a low fat diet is good or something like that. And we educate them that, okay, with cannabis, though, we want to see some of those healthy fats if we can, to really keep it in there and really get the best out of that plant. So, but you can give it at any time of the day. So, like you said, in the middle of the night, absolutely. You don't have to make
Yeah.
your loved one eat, a spoonful of peanut butter along with it. You just have to focus as a caregiver, how can I make it easy for both of us, and figure out that way to
Yes,
get it
great.
to them.
Thing. And let me just, again, since more people are joining, I wanted to say this is Katherine Golden. She is the CEO of Leaf 411, a nonprofit organization of cannabis trained nurses who are all about helping us as caregivers to really understand how to use hemp based products, to use them effectively, to use them safely, and to get them from sources that we can trust. And if you do go to the link in my profile, it takes you to my website, which is www.dementiacoachdiane.com. There you'll see a button that says Dementia Relief. If you click on that button, it will take you to the Healer CBD website, which is an excellent source of products. You don't have to buy anything. If you scroll down just a little bit, you'll see where it says book a consultation, and that will get you to Catherine's organization. And again, no purchase necessary. They'll guide you to the right products for your loved one and how to treat the symptoms that are most important to you. And that's what you want to do is have your list of symptoms ready that you'd like to address, but address them one at a time with Catherine's organization so that they can help you systematically address the issues that are most concerning, and to do it in a way that's safe and effective. So the thing that I also wanted to touch base on a little bit too is um, how should individuals make adjustments, because and when to make adjustments, as we talked about, I think a little bit. You want to, 3 days to a week, to maybe see the effects. What are some of the kinds of things that that you might want to adjust for?
Hmm. Well, sometimes, one of the parts of the history that we get is if your loved one has ever consumed cannabis, even in their youth. That's a really good indicator, because if someone says, "Oh yeah, my husband I know used it and he loved it. He said it made him more
Yeah,
creative and more
right.
focused, and it was a really great." Yeah, just like Ben, it was really great. Then we can take, a little sigh of relief and say, "Okay, they're probably going to tolerate this well." But if I get someone that says, "Oh gosh, my mother has never touched anything. She's 90 years old. I'm really nervous." We actually guide to even take that gummy and cut it into 4 pieces. Let's start with just a quarter of what that dose is. Even though we know that the full dose is effective and ideal for some, it's okay to start below. It's okay just to put a smidge in your system just to see how you tolerate it. And we warn people like they might not change at all. This is going to be what we call subtherapeutic. But if you understand that and you're patient, then we can work up slowly. So there's always ways we can adjust it. You don't have to take exactly what is written on there if you're nervous. And a lot of people that call us are nervous. We've had some people that have purchased a product and it's just sitting there and they're too nervous to use it. And then we've had some that say, well, my loved one has no issues. Do I need to start this program? I said, well, no, but we can give you some education so you know when it's time. You want to be prepared when it's time and you're ready and you're comfortable, because we want you to slowly walk into, just dip your toes into that pool versus jump right in if you don't have to, because we can walk you in very slowly. And make you comfortable. And it's all about the caregiver's comfort, because they're the ones choosing, when to do this. And sometimes you have a whole family around you and everybody wants to know. I've been on calls just this past week where I had two sisters and the brother on the phone, and everybody's on the phone saying, okay, well, tell me about this. Is this safe? And tell me all about integrating cannabis. So it's really nice when we get the families too to come together. But and so that way everybody feels comfortable about using this plant.
That's so nice to hear, because I don't have anybody else I have to argue with, but it can be a really big issue. I know when people have different opinions, and because of some of the legal issues that THC has faced throughout the years, it can have a stigma attached to it that I think it's a shame, but I think we're starting to get past that as we see just how powerful and effective and safe the plant medicine can be. And just, I want to speak briefly, because obviously this is something that I'm just beginning on, but my goal is to actually get Ben off some of the pharmaceuticals that he's on. And I just saw a question come through about how it interacts, how hemp-based products could interact with other medications. So first of all, could you address that? Because certainly that's one of the things you would want to know, is what else is somebody taking, and are there any possible drug interactions? So you address that right away, correct?
Right. Yeah. That's another part of our intake, is what pharmaceuticals is your loved one on. A lot of people are worried about what we call drug to drug interactions, and which really great is we can share the resources that we have. Every clinician will use their favorite resource to check, but we all basically use the same. One of my favorites is Medscape. You can go to Medscape and you can see that they have a header called drug interactions. And all you do is you type in the name of the pharmaceutical and the name of cannabidiol. You can put CBD, it populates it for you. They don't typically have THC, but they'll say marijuana or cannabis. And then you can see if it says if there's an interaction. What's really comforting, and what I love to tell caregivers and people who are interested in consuming, is that it's a really safe plant to start with. When you're looking at drug to drug interactions, those interactions don't typically happen until you're in, what Dr. Sulak will say, the triple digit numbers of a daily use, 100 milligrams of the CBD, something like that is when we start getting a little bit, okay, let's look at that interaction potential. And what I always tell people is that there's no contraindication, meaning you can't ever use cannabis in X, Y, or Z drug. It just means that there's a caution that if there is an interaction. But when you're starting with some dementia behaviors and we're looking at that, you're far below it. Like I just gave you an example of the day dose, or even the night dose, 5 milligrams of CBG with 2.5 of THC. You're nowhere near a drug to drug interaction. So that's the first weight I like to take off the shoulder of the caregiver. We're nowhere near concerned with that. And that's a beautiful thing to at least have that relief. So not typically till you're in the very high milligrams of a daily dose do you have to be
And
concerned.
I think that's certainly a relief for me, and I'm hoping now, again, this is not to advise that anybody do this without a professional's guidance, but I am going to start to wean Ben off the antipsychotic that he's on, because I'm not even sure why he was placed on it in the first place. I think that can oftentimes happen is that our loved ones are placed on these cocktails of medications just because that's what they do for dementia. And you're like, wait a minute. So, I have found certainly that sometimes the products, the pharmaceuticals can cause more problems than they help. And yet with plant-based medicine, if anything, I have found it, I never had an adverse reaction with Ben. If anything, perhaps I wasn't getting the effectiveness that I'm getting now, but I never had, as I said, an adverse reaction of any kind. So I'm grateful to know that it was just the combination of products that, we were using, the dosage that we were using. And in our case, less was actually more, which was, was something that I was really grateful to find out. So,
Yeah. Yeah, so that's one of the things we do remind caregivers is make sure you talk to the prescribing physician for a weaning protocol because it's very important. Some of these antipsychotics are very strong and you have to be careful how you wean. So, you know, we really talk about like just when you're integrating cannabis, that's what it is. It's an integration. It's not like let's throw all out
yeah,
this other stuff out the
right.
window and solely use cannabis. What we say is we know a lot of people want to reduce those pharmaceuticals that have the black box warnings that they can cause stroke and heart attack. You know, those are the scary ones. So they want to start weaning those. And that's what you can do as the caregiver is go to that prescribing physician and say, okay, please give me a weaning protocol. I want to do
Mhm.
this safely for my loved one and follow that. So that's always really important as you get the clinical team involved and you share with them that, okay, I'm integrating cannabis. I've got great clinical support. And we even tell people, tell them to call us. I would love to talk to their, clinicians too and help them understand the safety around cannabis, guide them to resources, anything that they need as well as the clinical team. You know, that's where our peers are. And, we can talk that
And
clinical language with
And I
them.
really appreciate you sharing that because I know that there have been people who have said, like, my doctor doesn't approve of it, or, he won't help me. And oftentimes, from my experience, it's not that they disapprove so much as they're not trained to help. And so they're really
Right.
only trained to work with pharmaceuticals, and therefore they don't want to advise with
Mhm.
something they don't feel comfortable with. There are uh, the Society, I was going to say, of Cannabis Clinicians, correct? Did I get that right?
Yes, you got it right.
So, is that a source for caregivers as well, if they want to actually find a clinician that is trained in the use?
Yeah. Yep. We have all those resources. Society of Cannabis Clinicians is an excellent one. You plug in your zip code and you see if there's a cannabis clinician near you. And then we also will look for clinicians because we do have loved ones that are in facilities. And that's a little bit different. That needs a few more steps. You can't just bring it in and start handing it to your loved one. You actually have to get the physician who's taking care of your loved one to write the order. And the beautiful thing with the healer products is they give you kind of a step by step on how to get that done. And then working with them, we're actually hearing from some people in different states saying, okay, I need a clinician now. My clinician is on board, but doesn't want to write the order. So how can I now get this product to him? And that's where we're healers going out and finding cannabis trained clinicians in those states to provide that
Uh,
service for you. So trying to kind of put all of it together to really hold that hand of the caregiver to help them get this into a facility that has more
that's
restrictions.
such a great piece of information that I wasn't aware of. And once again, for those that are just joining us, I'm talking with Katherine Golden, who is CEO and founder of Leaf 411, a group of a nonprofit organization, a group of cannabis trained nurses who are uh, not connected with, but you can access their organization through the Healer CBD site. If you go to my website, there is a link in my profile to my website, dementiacoachdiane.com. Just click on the button that says Dementia Relief. You don't have to buy the products, but if you get into the Healer CBD site, scroll down just a little bit and you'll see where it says book a consultation. And what is so wonderful about the Healer products is that they are packaged in a way that makes it so easy for you to use as a caregiver. This is the stage 1 day, this is the evening, and it's a dosage that has been tested in clinical trials to be very effective for dementia related symptoms like aggression, agitation, sleeplessness, sundowning. And these are the things that not only distress our loved ones, but they can be just rather distressing to the caregiver as well. So the Healer CBD site and Katherine's organization, two independent organizations, but together have really been so instrumental in increasing awareness and providing resources and education so that caregivers can make use of this amazing, I feel, solution. It's an option. It's another solution for treating dementia-related symptoms. And for those of you that are caring for individuals that are having challenges with appetite or sleeplessness, they don't necessarily have to have dementia, of course. They can still contact and have book a consultation with Katherine's organization and get some help as well. And I was going to, we just got the question, what can you suggest for the caregiver? Because we need to sleep and we need to be able to wake up feeling refreshed. So can you speak, I'll share my own personal experience in just a minute, but Katherine, if you could speak to what you found has been really helpful to maybe lengthen the fuse of the caregiver and help us to be a little calmer and make some better choices.
Yeah, and it's funny because we do guide the caregivers also. We check in with them and say, well, how are you doing, as well. And a lot of them lack sleep, a good night's sleep, you're just on guard a lot. And then during the day have this anxiety too, because like I've heard from a lot of them is that you don't know what's going to come next. You don't know who you're going to see. Which Ben am I going to see today? Which Ben am I going to see this hour? So
Yeah,
you're always on guard, and that's high
fight or
anxiety.
flight.
So what's really yeah, what's really interesting is that even the combinations that we have, like I said, these aren't dementia medications. They're not specifically only for dementia. What they are is they target the behaviors. So if it's anxiety, well, if you have anxiety, the same combination can work for you as well as the caregiver. So I had one that the night version didn't really work as well for her husband, but she started taking it and said, wow, this actually helps me sleep. And I said, yes, because CBG for sleeplessness and mood and THC can help with sleeplessness too. And the combination at these low doses are perfect because you're not heavily impaired. You're just feeling calm and sleepy. So it's a beautiful combination. You can wake up instantly, not like pharmaceuticals, when you get those Ambiens and that are stronger that some people, have the sleepwalking and things like that they stay away from. This is completely different. It's more mild in that sense where you can wake up out of it. You're not impaired or groggy because they're at such minimal doses. So it's a really great way to try it. And some of the caregivers said, I even felt more comfortable giving it to my
Once
loved
you
one
tried it.
once I tried it. And yeah, so you can use, and CBD for daytime anxiety really helps. Like I said, homeostasis brings that calmness back to the body and without impairment. So you don't have to worry that, oh, I'm taking CBD and I'm going to be, a little out of it. It doesn't do that. It just brings this calmness. So yes, the caregiver, I worry about them a lot. We'd like to check in with the caregiver as well and say, what can we do to help you as well?
Well,
So
and
the plant is
I was going to
beautiful.
say, speaking from experience, I do use the rest gummies from Healer. They're the perfect combination. I use a half a gummy, and I think as
Hmm.
you recommended too, I started out with a quarter for 3 days. I didn't feel anything, but it just primed the receptor sites so that then I bumped it up to a half and it was just perfect. And, as a child of the 70s, I know what it feels like to get a buzz. And I'm not saying that there's a part of me that wouldn't enjoy that. But I can't afford to be impaired. I don't want to be
Hmm.
impaired, of course. I just really wanted to be able to sleep and stay asleep. That was my biggest problem, is that if I woke up for any reason, I couldn't get back to sleep because my mind would start to swirl. And now I find that now I personally will take a half a gummy at 8 o'clock at night. And then and I don't really feel it, I don't really feel it at all. I just realized that by 9:30, once Ben's asleep and I'm ready to get in bed myself, I'm feeling relaxed. I think, not even
Hmm.
necessarily sleepy, just kind of relaxed. And I fall asleep
Hmm.
without a problem, which is a miracle. And even if I get up once or twice in the night, I can go back to sleep. And that's been incredible. And then I wake up, like you said, without any after effects because I don't like the effects of pharmaceuticals. I oftentimes feel groggy in the morning and I have enough of that. So again, I can't say enough about how much I appreciate your guidance and the Healer CBD products because they're just the right combination for me. So
Yeah. They're easy. And that's the beautiful thing. You want something easy. You have enough to deal with, you know, all day long, all night long. So you just need something easy. And that's where we like the manufacturers that are really thinking about the consumer. You know, what do they need and how can we make this easy for them? And that's why we put our full support behind healers because they really did think about that and giving you all the access to the resources you need regardless or not if you need the product, you just are getting information wherever you're at in the journey. They just wanted to make sure that we were here to help you. So, and we are for any, and that's any needs, you know. I had someone yesterday that said, you know, she's like, I want to talk about my husband in dementia, but I also have restless leg syndrome and I would like to integrate cannabis and, you know, how can I do that? And I said, great, let's talk about that after we're done.
terrific.
So, you know, so it can be for
Terrific.
anything.
Well,
Yes.
once again, Katherine, thank you so much for being, as always, such a delightful guest and offering so much good information. Thank you, everybody that's joined us for this call. I just encourage you again, you can go to my website. It'll give you a chance for a button that says dementia relief, but for any kind of relief, just get to the Healer CBD site. Scroll down just a little bit, you'll see book a
Mhm.
consultation. You can book a consultation with Katherine's staff, and they'll guide you one step at a time to the safe and effective use of hemp-based products. So we just, again, thank you all and best of luck.
Yes. Thank
We
you.
are so grateful for, again, your support and for all of those in the community that have been so loving and so supportive. Please start to share your stories in the comments too. Those of you that have had good success, if you'd be willing to share your comments, I'm going to post this recording of the recording of this live, but please post your comments because the encouragement and the love and the suggestions that are exchanged here every day have been so valuable. So I think it can really help others to say, yes, it's worked. Go for it, right? All right. Thank you so
Yay.
much. And again, everybody have a wonderful holiday season. Let's see if we can have a more peaceful holiday
Yes.
season for both our loved ones and for us as caregivers. Thank
All right.
you. See ya.
Thank you.
Bye.